Good day everyone, I am Jane Paran and today I am going to do a postpartum head-to-toe assessment using the bubble tea technique. First, wash hands, then provide patient privacy and verify your patient name and date of birth. Then wear a clean gloves. So, let's going to do the assessment. Good morning, Mrs. Johnson. I am your nurse today. Ma'am, how are you feeling today? I'm just gonna do a postpartum assessment. Is it okay? So, the first B in bubble tea stands for breast. We check it first. We're gonna ask mom, how do you breast feel? And she could say if it is heavy or she said, I don't feel anything. It is normal. So you can start to assess the breast. Palpate both breasts for engorgement or swelling. Using back of your hand, feel the breast if it is cool or warm or hot to touch. Minimize palpation for the bottle feeding mother to avoid stimulation. Then check nipples for pressure sores, cracks, or fissures. Evaluate whether nipples are everted, flat, or inverted. If one nipples are inverted and the other is everted, it is considered normal. We also check if there are bruising or suck mark or cracks or bleeding because this sign may indicate that the baby doesn't have a good latch. If that's the case, we should teach mother that all mothers should wear a supportive bra 24 hours a day for the first few days postpartum. In engorgement, it usually occurs 2 to 3 days postpartum. To apply warm pack or keep pad 15 to 20 minutes pre-nursing. Then try a warm shower before nursing, then ice bags and binders for non-nursing mother. Then we are going to move on to U. It stands for uterus. Now, I am going to do a fundal check. Make sure that mom is perfect flat in doing a fundal check. So, expose her abdomen, 2 hands for fundal check, one hand support the bottom of the uterus and the other hand feel the fundus. If she was delivered today, the fundus should be at the level of her umbilicus. So it is there. And the three-way should describe the fundus are firm with the sage or baggy. Then record finger widths above or below the umbilicus. If the fundus to you, it means 2 finger breadths above the umbilicus. And if fundus U2, it means 2 finger breadths below the umbilicus. Remember that the fundus descends 1 finger breadth each day. So, it is important to ask mother if she was void every 2 to 3 hours. A full bladder may push the fundus to the right or left of the umbilicus and cause the patient flow to behavior. In tune, fundus should remain firm. If uterus becomes baggy, gently massage uterus to help the muscle to contract. There is IV. Adjust IV flow rate to control bleeding. If Pitocin is in the IV solution, and if no IV, administer PO or imetergine or ergotrate per doctor's order. So, now we are going to second B in bubble tea, and that is the bladder. So, we should ask mom, when is the last time she void? You should remind her that it is important to void every 2 to 3 hours. Even if you are not feel to void because it can help her to heal faster. Then, palpate the distension above the symphysis pubis. If patient has not voided in 6 to 8 hours post-delivery, straight cut per doctor's order. Then notify doctors for any voiding difficulties. Be alert for sign and sign of UTI. Infrequent voiding, the painful urination or dysuria, burning, frequency, the urinary retention, the full smelling urine. Then the postpartum voiding difficulties is related to fatigue, perineal swelling, long, difficult labor and delivery. So now we are moved to third B in bubble he, the bowel. So using stethoscope, listen the bowel sound. There is no reason why a postpartum who delivered a normal vaginal delivery have not have bowel sound. Assess for presence of BS, Q-shape, palpate abdomen for distension. Administer daily stool supiner per doctor's order. Avoid use of enemas or suppository for patients with a third or fourth degree laceration. If needed, use with caution. First, BM usually occurs on or after second day. Best for patient to have BM before discharge but may not happen. Often sent home with stool softeners, encouraged to eat fibers and exercise. Then we are going to check L, which is lochia. Assess peripad daily 1 times each shift for color, amount, type, and for any foul odor. If you see this, ask mom when is the last time you change your pad. Because it is important to know if it is okay or not. Postpartum are high risk in infection. So we should teach them to change their pad regularly to avoid infection. There are 3 different types of lochia: the rubra, the serosa, and the alba. And this is the alba, which is the yellowish or whitish discharge. Lochia rubra is bright red color. Then the serosa, the darker brown color. Instruct patient to notify nurse if she passes clots. Then call for any excessive bleeding. Then the pericare. Instruct patient to fill peri bottle with warm water and rinse stitches area after each voiding or BM. Wipe from front to back, patting gently. Change peri pads after each voiding. Spray episiotomy area with anesthetic spray after wiping. Apply 1 to 2 tack pads to peripad with each pad change. Encourage use of sets bath 24 hours postpartum per doctor's order for 20-minute bed, especially if patient had a third or fourth degree laceration. In episiotomy, assess using RIDA every shift, the redness, edema, ecchymosis, discharge, and approximation. Position in lateral Sims position with upper knee bent. Gently lift the buttocks to view perineum. Flashlight may be helpful. Apply ice bag if ordered for 6 to 8 hours post-delivery to minimize swelling. Assess for presence of hemorrhoids. Teach patient to apply medication as ordered. Most women delivered with an episiotomy, midline or lateral mediolateral. The third degree extension, the laceration extends to rectum. In the fourth degree extension, laceration extends through the rectum. Then H4, human signs. Expose the mother's legs, then support the knee behind your hand. Then dorsiflex the foot. Then you're gonna ask her if there is a pain or tenderness in her calf. Assess daily of redness, nodular or warm areas, discoloration or leg varicositis, and notify doctor. Assess human sign Q shift. Then assess peripheral pulses and for presence of an amount of edema. Women are more prone to thrombophlebitis postpartum related to hypercoagulability of the blood caused by pregnancy or normal changes, anemia, pelvic infection, trauma delivery, and obesity. E for emotional status. There are 3 stages in emotional status: the taking in, the taking hold, and letting go. In the first stages, taking in is when mother is focusing herself if she is hungry, she is in pain. And in second stages, the taking hold, she must be interested to do for the baby care. She may be take care of the baby, then interested in self-care, then in letting go, reestablishes relationship with other with outward focus.